Thanks for tuning in to the first Way Back Wednesday episode of November. I'm Colin, a receiver, founder and CEO of SmartBox Web Marketing. For today's Patient Attraction podcast, I want to fly way back to a classic podcast from February 11th of 2013, the one about how to speak the language of your dental patients. Now, this has never been more pertinent than now, and like other dentists, you're passionate about your job. But that can also make it hard to relate to your patients and speak the language that the patients are speaking in their head. If you can't speak their language, you're going to end up losing them and repelling them with your marketing. Enjoy this important podcast and join me tomorrow for an exciting Throwback Thursday. Good afternoon, Colin, receiver here. And today's Fast Thoughts, I want to talk a little bit about the ancient city of Babylon. You have probably heard about the city from the Bible. The ancient city that is talked about, Babylonia, Babylon, and the languages there. Everybody spoke different languages, and if you really go back to the core, if you look in, say, the Hebrew Bible, and you look up what the root of Babylon means, the definition of Babel means confusion. If you look at the verb form of Babel, which I'm not sure I'm going to pronounce this correctly, but it's bilbo, it means to confuse. Now, why am I talking about Babylon on a dental marketing video? Well, in many dental practices, the language that you're speaking is not being heard by your prospects. Your patients, your prospective patients, are speaking a completely different language than what you are speaking when you're trying to market to them and talk to them about how you can help them. Many dentists out there, dentistry is not just a job for them. It's a profession, it's a hobby, it's their passion. And when you are very, very passionate about something, it's hard to remove yourself and think about how the other side feels. It's been said many times that the smartest people in their given field are horrible educators because they assume that the other side knows things that they don't. And when you're trying to educate your patients, when you're trying to market to your patients and speak to them, they don't hear the same things that you're talking about. I did an interview with Dr. Woody Oakes last year, and Woody made the comment that a lot of dentists spend more time selecting their new handpiece than they did selecting their spouse. That they spend all kinds of time trying to get the right tools and the right equipment and the next greatest thing that's going to help out their patients, but they don't relay it to their patients in a way that their patients can understand the benefits. And that is what your patients are looking for. You have to speak the language of benefits. Translate that new handpiece into something in emotional terms in how that's going to affect that patient's life. The new handpiece, it's not just the latest thing and it does X and X RPM and it can prep a crown with these new diamond drill bits and X this and all this much faster. Here's what it means to the patient. 80% less noise. Don't like the buzzing sound and the noises that you're accustomed to hearing at the dentist. This new handpiece we have, you won't have any of that. Less time in the chair. You don't like to have dentists with their fingers in your mouth. That's okay. With these new equipment, this high-tech stuff and equipment we have, now you're going to spend 60% less time in the chair. There's all kinds of different pain-free tools out there these days. There's topical creams you can put on. There's different types of syringes and all kinds of stuff out there. I'm not even going to try to pretend like I know that is coming out these days to do painless injections. Don't talk buzzwords.
talk in plain, simple terms. We can give you an injection, we can numb you up, and you're never even going to feel it. Fear of the dentist. Did you have a previous bad dental experience? We can fix that. That is the language that your patients are hearing. Make sure you're speaking that language. Things patients are going to look for in a dentist. They want to know that the dentist is experienced and skilled and has the latest equipment. What they don't particularly care about, or they don't necessarily understand, and it's your job to educate them so that they understand, is what the alphabet soup of accreditations and continuing education actually means. Don't just list all of your credentials on your page, on your website, or on a brochure. Tell them what that means to them. What does it mean that you went to the Las Vegas Institute? What does it mean that you went to Portugal to study under Dr. Malo, and you now have this all-on-4 training? What does that mean to the patient? And when you can speak the language of the benefits, you'll attract more of the types of patients that you want. So that's all the fast thoughts for today. Keep moving forward.